The hour.
Very good.
So we'll go ahead and get started. Good afternoon, everyone, and welcome to Palpation Abdomen Simulator as presented by Kyoto Kaguko. I do a horrible name with this, Abdabby. And just a note that by registering for and viewing today's virtual learning lab, you agree to receive follow-up communication via email from representatives with Kyoto. This session is being recorded and will be uploaded to the online learning section of the SSH website by the end of this week. We ask that you keep your camera off and your microphone muted for the duration of the session. If this is your first time tuning into a virtual learning lab, please note that these sessions are held each Wednesday at various time slots during IMSH delivers. You can view the list of virtual learning labs and register through the IMSH scheduler. And now I'll turn this session over to Paul Allen. Paul?
Good afternoon, everybody. Just quickly, my name is Paul Allen with STR, and I'm doing this on behalf of Kyoto Kakugu, which means medical science in Japanese, and Kyoto is the city where the factory is. I wanted to introduce you to the abdominal examination simulator that they call Abdabby. As you can see in this PowerPoint, you can see the abdomen, you have the ability to insert different organs with or without pathologies, begin your auscultation, palpate, easy palpation or light palpation and deep palpation. What's very important to note about Kyoto products in general, and especially with the abdomen, is that the skin is extremely resilient and flexible. It is a patented material that allows you to compress deeply. It allows you to have a resilient material that comes back to its original form as you apply your compression, meaning that the experience of the palpation of the abdomen is as close as you can possibly get to the human experience, because you actually apply pressure and you can actually feel organs underneath, and you can actually feel cases and pathologies underneath. This is very unique in the sense that the realism there reenacts this experience. So if you're someone who is unexperienced and not used to this practice, this is a good introduction to that experience. And it's a much better product for recreating that environment for simulation. There is an assessment that goes with the abdomen in all disciplines, whether it's nursing to physician's assistants to medical simulation to medicine. And these are the ways that we can palpate and feel the organs. As you can see, they're anatomically, we have bony landmarks. We have all the abdominal area. We have the liver, the lymph nodes, the spleen, the kidney, the uterus, and we also have the ability for bruits and sounds. So you can auscultate, you can light palpate, and you can deep palpate. So there's also percussion. And important to know, Kyoto Kakugo is an anatomical company. So all of these structures, and I'll show you at the end of this PowerPoint, are anatomically correct and highly realistic, to the point even where the organs themselves have different feelings of material that are utilized to create them in 3D. So it's something important when you're palpation, you can see a very different, as saying tumors would have their spiculation to them. They would have the feeling that you would have of something that is not healthy. You could have the enlarged spleen and things like that. You can see the polycystic kidney, all the different cases and their specificity. All the organs are interchangeable. So what happens, you're able to access either from the side, from the top, or from the bottom of the mannequin. You can replace the different organs. So as you can see, we have the uterus, we have spleens, we have kidneys, we have, for example, hypernephrosis, slightly enlarged. We have cirrhosis, chronic hepatitis, and etc. I'll show those to you at the end of the PowerPoint. These are the 4 types of livers. What's really nice is that we have a foot action pump that is connected to the abdomen to create respiratory movement. So you can replace those organs, the livers namely, and you can actually palpate and feel the respiratory movement, which is very nice and very realistic, and is also a self-guided learner, meaning that you can actually use this trainer without a proctor. So there's a self-guided learning, or you can also have a proctor present if you'd like to do some training, education, and assessment. We also have, as you can see, the kidneys. This is how they access them from the side. You place the organs, whether it's cysts or hydronephrosis, into the side, and then you can palpate. Very important feature of the Kyoto Kakugu Abdabby is that you can actually palpate posterior and anterior. You anatomically, that is correct, and also very important in training both domestic and international. Spleen's the same idea. It goes on the inside, and you have a slightly enlarged and an enlarged spleen. Very easy to change out. It's very important to note that the haptics of these products are extremely realistic, and it's something that is very well understood if it is actually felt and palpated. As you can see, the uterus and the lymphoma in the area, you can see the different types and the different types of lymphoma that you can interswitch from the bottom area of the mannequin. Excuse me, I'm just admitting someone. And now, the new Abdabby has a different system for the stethoscope. Initially, it was a sound-based system that didn't have a touchscreen visual feature. Now, it has a touchscreen feature which allows you to hear the sounds, and I will demonstrate that for you. So you have the localizations, the area, and you press where you'd like to put the area. It's very nice and very handy. You have the benefit also, as a self-guided learner, of using headphones and hearing the noises and the sounds and the auscultations internally, or you can play them out through speakers. So you can have classroom learning or associated learning or distance learning. This is very useful in a setting for task trainers and setting up on tables. There are some schools that have as many as 6 of them, 4 of them, 5 of them, 3 of them, 4 of them, depending on how they're teaching. Setting them up with normal cases, abnormal cases, all lined up for different stations for training. It's very nice for interdisciplinary learning, station-to-station learning, self-guided learning practice, and also the ability to recreate haptics and palpation, possibly with SPs. Recently, there has been some trending with some SP programs being limited due to obvious interactions with patients, which are going to be limited. So standardized patient programs are considering using the abdomen for their palpation, since it's difficult to accomplish with a standardized patient. And several programs recently have purchased for that reason. It's very important to note that this will be something that you can recreate. You can also create pathologies, which you will not have with a standardized patient. You can only suggest pathologies. You're always associated with normalcy. This is an advantage that you have with this model, and also the fact that it's very realistic for a simulated trainer. As you can see, as I was talking about the touch screen, you can see how it's just you place your finger and touch what you'd like to suggest, whether it's the renal artery, you have bowel sounds, iliac artery, renal artery, aorta, and iliac artery. You can also increase the volume and control the localization. And again, you can hear that audibly through speakers, or you can hear that internally through headphones. As you can see, you can also manipulate some of the device settings. It's very easy to use. It's very easy to calibrate. It uses a sensor-based technology with a simulated stethoscope, and you can also play out loud. There are other types of abdomens out there. Some of the important things to note is that there's a very realistic palpation that takes place. The material itself is very, very flexible. The skin itself is also soft, and the organs are actually hard, so there's a real feel. You actually get resilience to the material, so when you press through, it returns to its original state, very durable. There's different hardnesses for different livers. You'll see that there's actually a 2D aspect to other products. These organs are actually 3D, and the pathologies that you feel and the speculations that you feel with the tumors and the like have a realistic feel to them. This is something that is best demonstrated. You can initiate deep palpation and shallow palpation. As you can see from this visual, you can see the deep compression that he's initiating. You can see how deep it comes and it returns to its original state. You can also, again, palpate posterior and underneath, which is unique to the Kyoto Kakugu Abdabby. Many of the other trainers is a very shallow palpation, which is not the full range of the different OSCEs and assessments. As you can see, here is the 3-dimensional livers versus the 2-dimensional livers. As you can see, we have the normal versus, for example, the chronic hepatitis, the cirrhosis. Really nice is they're very easy to interchange. You actually lift up the upper torso and you take it off, and then you can actually insert and change the liver. So it's not, there is no software, there is no programming. This is a low fidelity task trainer that accomplishes majority of your assessment tasks with palpation, starting first with auscultation, which is complete, going to light palpation, going to deeper palpation with specific cases. As you can see, there's the different ones. The way that they accomplish respiratory movement is they have a manual wheel system for other trainers. This is a pedal system for self-training. So you don't actually have to have a proctor present, and you control the respiratory rate. I have personally demonstrated this product to several programs throughout the United States recently, and I have gotten very, very good feedback on some of these aspects, including the respiration movement, the feeling and the palpation of the organs underneath the skin, the fact that you can actually deeply palpate, which is very important, and the sounds that are played through either speakers internally through headphones are all real, actual cases. In some cases, a lot of products and a lot of different trainers utilize simulated manufactured sounds. These are sounds of actual cases, and everyone knows there's quite a distinction from the actual case that is heard, and in terms of auscultation, they're not. As I will play for you later, I will play the bowel sounds, I will play the aorta sounds, and you'll notice the difference. It's quite conclusive. We have also had some studies and some trials in Japan. Kyoto is a Japanese company, and they have found great touch and feel, or as we say it here quite often is haptics, and also having a better understanding of pathologies. I have spoken to some colleagues that I've worked with in both nursing and medicine, and they said this is a great introduction to the process of using, learning about different levels of diseases, symptoms, and everything else, and be able to concentrate on the physical assessments. Not where imaging is important. Imaging is definitely a part of this process, but in training, you definitely want to have the ability to internally get your own physical findings through your own palpation and learn that experience in a non-clinical setting. And as we know, the clinical settings are sometimes difficult to come by, and we want to have as many opportunities like that to create those environments with simulation. Those are some very important factors. I'm going to switch over to an actual visual demonstration of the abdomen. So I'm going to switch, and I'm going to stop sharing my screen. I appreciate everybody's technical patience. Okay. Can everyone see me? Everything okay? So basically, this is the Abdabby. Is everyone seeing me okay? I just want to make sure the camera's on. Yes, let me invite someone there. Okay. Basically, as you can see here, this is the size of the abdomen. Here's the stimulated stethoscope. As I was speaking about earlier, here are the different organs. This is the spleen. As you can see, it is a 3D representation of the spleen. There is a side entry point that you can pull this out and you can place the organ inside. Then as you palpate, as you can see here, very deep palpation, and it returns to its original form. It even has an impression that goes away, just as it would in skin. As you can see, the returning to its original form, different 4-quadrant abdominal palpation. Bear in mind, I'm not a clinician, but I have done some training with this type of product. But you can see how you can press down. Also posterior, you can apply pressure. You can apply pressure here. But notice how deep the compression is on the mannequin. If I wanted to auscultate, which is I would do first, the first step in the process, I can actually hear, I'm going to play this through the speaker, as you can hear the bowel sounds. If I take it off, the sounds don't work. If I come back down, the sounds are recurring. And as you know, you have to listen for a while for the bowel sounds to originate. We can also switch to a different quadrant and we can listen to the aorta. If I don't place in the right area, you will not hear the sound. I'm going to switch to the renal artery. I'm going to go back to vowel sounds. You can hear the different regions. I can increase the vowel sounds. I can also decrease the vowel sounds. I can also recreate an ileus, which is the actual sound of the ileus. Here's the ileus. As you know, you have to wait for vowel sounds. And I can also go back and go back to an increase in vowel sounds if I'd like, and change the different cases and pathologies. However, I'm training. As I explained earlier, this is the touch screen that works here. You can pick the sound you want, and you just pick them by touch screen. This is the simulated stethoscope, which you use here. Here's an example of the liver. This is actually I believe this is a cirrhosis case. As you can see that it's three-dimensional. If I bring that to the screen so it has a different feel than a normal liver, I will demonstrate that you can remove here. You can take off the top area of the torso and you can just take out. This is a pre-cirrhosis model here. Here's a different liver. If I want to switch these out, I can pick it up here and place the different case right in here. And as you can see, it's actually, you can feel it in there. And then as I palpate, I have a wheel, I have a pump underneath where I can actually create auscultation. And I can actually create respiration. And I don't know if that's visible with the zoom, but I can see it rising and falling. I hope you can as well. And I can create the respiration. There's also the bladder, the kidneys. Here's a case right here. So you can see the variations. But the important thing to note is the realism and how when you palpate, as you can see, it's returning to its original state. And if I push here, it's both you can feel the organs and you can feel the tenderness of the skin, which is a very realistic experience. The other thing to note also is the cross-disciplinary nature of this product. It works with all sorts of modalities, obviously, because all different practices of medicine utilize this type of practice. Light, deep palpation, auscultation. Does anyone have any questions so far? Is there anything I can sort of help with? Okay. The other thing I want to mention is that there is an aspect of this as a task trainer that affords the ability to use station to station. So you can have multidiscipline stations for different training. Typically, schools have been buying more than one. Actually having one set up for normal, one set up with cases and pathologies in a room for about 4 or 5 tables for the training of their students. This is really nice because you can go immediately from station to station and focus on your own cases and your own pathologies. As you're building your own scenarios for training, whether it be an SB program or any type of simulation for a sim center, you have so much versatility here, as you can see the variety of cases. The other thing is there's no fluid, and so there's no change in the conditions with weather, with repositioning. This is a static but palpable abdomen that will not change, so it won't deteriorate from fluid being inside. The skin won't deteriorate because it has a resilient form to it, as we demonstrated in the PowerPoint, that shows its ability to return to its original form. Another example of this is an OB training birthing model, which returns to its original state after giving birth. It's the same type of skin. To see that in practice is quite something to behold, because a lot of the other trainers don't have this resiliency of the skin. It is a patent technology. It is exclusive and unique to Kyoto Kakugo, and their ability to create a skin that has such a realistic experience. Does anybody have any questions or anything I can help with? I'm happy to go into further detail if anybody has any questions about the simulator.
Yeah, Paul,
Mm-hmm.
any feedback from the units that you've had in the field after they've used them for 2 or 3 months? Anything that they might have learned, or just sort of anecdotal evidence from the field?
Well, I think the thing is there's this we in clinical and also in simulation, you have this aha moment with students and with practice. And I've seen some aspects where you look at someone actually performing the palpation and you see the reaction as they sort of have this association, recreating somewhat of the real event as the proctor's showing it to the student, which is exciting to me because they're like, yes, that is how it feels. Yes, that does remind me of this experience, and recreating it in the simulated environment is helpful, especially if you're trying to familiarize a student with this experience for the first time. Because just like all forms of clinical practice, it's very intimidating, and it's very, very good to get your experience of how you're going to go about your process on simulated material. So yeah, absolutely. I've seen that aha moment. I've seen the light go on, and I've gotten great feedback. And knowing that it's utilized quite often, especially against standardized patient programs.
Yeah, Paul, follow-on question. Is this currently being used in the U.S.?
Absolutely. Just recently, there's been several sales to some United States programs, and there have been programs that have bought last year. And again, like I said, they're most of the time multiple system purchases. And for example, one right recently is a nursing school, but there's also PA programs. There's medical residency programs. There's osteopathic medicine. There's a lot of different programs recently purchased. And then of course, PA again. So there's a great deal of interest, and also being currently used in practice. And one of the things that's really, really nice is that the multidiscipline, so a sim center, it's a perfect application. Does anybody else have any questions? I want to also make everyone aware that these products are made by artisans. They're handmade in Japan by people that are artists. Kyoto is an artisan city in Japan that's very, very old, and they've been making craftsmanship for a very long time. So there's a great deal of pride and care and preciseness and quality that goes into Kyoto Kakugo products in general, and of course with this abdomen. This abdomen has been utilized many, many times, and as you can see, the skin is completely resilient, and I would dare say looks new. As you can see, as I'm compressing, I'm pushing down, I'm even stressing a bit to push, and it returns to its original form, even leaves almost like an edema type setting that eventually goes away just like it would do in human life. I think one of those key things is haptics and simulation. And this is a great representation of the haptic experience for doing palpation, auscultation, and light palpation. Also, as you can see, this is a very portable, very easy to use, very easy to clean model. This goes in storage box, but it's actually not very heavy, as you can see. These inserts come out to replace the organs like I explained earlier. For example, here's the spleen, here's a liver, and as you can see, the inserts are very easy to switch out. And similar to the skin, they actually have a texture that's comparable to what an organ would actually feel like. So I think that's incredibly helpful. As you can see here, there's the pump, so I can control the respiration. And as I go through my 4 quadrants, I can change, again, the different sounds that come out of it. Any other questions? This looks like we have a chat question. Any school which are using the model in the U.S.? Yes, there are many. There are many schools in California, in Georgia, in Chicago. There potentially in Miami, there's an order upcoming. Louisville will be ordering very soon. There's actually a little bit of representation on the East Coast too. And I'm sure there's others that I'm not aware of that have already been sold. So yes, absolutely. And also internationally, it's quite well received. So anybody in the international audience, the Abdabby, you saw the comparison with the others, all the things that it's capable of. It is, again, the realistic skin is actually the biggest feature that I would like to leave with. Any other questions? Thank you for your questions, by the way. I also want to say, thank you to Judy for having this virtual learning lab. It's been quite a great experience to having the opportunity to connect with end users and also connect with other Sim Center personnel. I am incredibly excited with the idea of these type of products with their haptic feel being utilized in training, since sometimes the clinical experience and the standardized patient's experience will be diminished for obvious reasons. All right, here we go.
Paul, I just posted the link to the online learning section.
Thank you so much, Judy. And,
yeah, for those that want it. And I did send something to Julian on if you want to track it. And I sent that to him in an email. So
wonderful.
You'll have that.
I'm happy to take any other questions about the product. Does anybody have any questions? I think I would like to move on. I appreciate everyone coming. This incredibly anatomically correct simulator. If you have any questions, you could reach out to Kyoto Kakugu America, and we'll be happy to take your inquiries. In terms of any type of feedback or any type of references and things like that, you can reach out to us as well. Please go to the link that Judy provided for us if you'd like to get more information. And I appreciate everyone who attended IMSH this year, and I'm very thankful for the opportunity to reconnect with my sim community. I've been in simulation personally for about 15 years, and I appreciate the resilience of the community and the way to be steadfast through all these challenges. I appreciate everyone for coming. Thank you so much. And on a personal note, happy St. Patrick's Day to those that celebrate it.
Thank you, Paul. Good presentation. And the link will be uploaded no later than Friday, so they can go to that. And Kyoto is also an exhibitor. You can't find their link. They're linked on our website with a direct link to their website.
Thanks, Judy. Great job.
Thank you, everyone. Have a wonderful evening.
Okay.
You as well.
Talk to you soon.
Yes.